Good morning to you, Dr. Bart. Nice to talk to you again.
Good morning, pleasure.
How common is miscarriage?
Well, 1 in 4 women will experience miscarriage throughout their lifetime if they try to conceive, and this is part of a natural process of fertility in humans.
Strange question. What element of nature defines or decides on miscarriage?
Okay, half of the miscarriages will be unexplained, so still all the results will come back as normal. However, the main contributor is genetic abnormality in the embryo. A good proportion of embryos that are created in nature do not even reach the moment of implantation, and they cannot signal that they are there.
So the body knows that, there's going to be something that's not viable.
Yes,
so
sometimes this mechanism in the womb, let's put it simply, fails, and a pregnancy that should not establish is progressing to a certain stage. And if you imagine that the embryo is missing certain chromosomes, so a part of DNA material is missing, it cannot progress beyond a day of their life.
Are miscarriages investigated, or are they only investigated after a few, say, in a row?
In fact, they are investigated typically after 3 consecutive miscarriages, so 3 pregnancy losses mandate further research. As harsh as it sounds, the reason is that until 3 miscarriages, a live birth is most common outcome of the next pregnancy. So until then, it is regarded that, the next one will carry on.
Is there any input of the sperm into the possible eventual miscarriage?
Yes. Men who have what we call excessive sperm DNA fragmentation, so quality of DNA in sperm is not good. They typically have more miscarriages when trying to father a child. The other one is, some blood clotting disorders. They are inheritable, and there are patterns that can be also contributed from the male side and increase the risk of miscarriage for the given couple.
So the decision around IVF or other methods, when should that come?
Well, IVF is not a method to overcome miscarriage as such. However, if there is a need for IVF, if there is an indication to do IVF, the risk of miscarriage can be lowered by embryo biopsy and studying the chromosomes. As I told you before, half of cases will be unexplained, but of the other half, gross majority, it will be like 2 out of 3 cases, will be driven by abnormal chromosome counts, and that can be investigated before you ever decide to use the embryo. But again, IVF is not a method for managing miscarriages. There are some means and ways of reducing miscarriage within IVF, so there has to be a condition that requires IVF first.
Very good. Well, thank you for a very informative conversation this morning, Bart. That's
always a pleasure.
I hope it's useful to people out there. Thank you very much indeed for your time.